Hi, this is Doug Suddarth with RelayHealth. We'll be getting the demo started in just a second. Hi, good morning. This is Doug Suddarth with RelayHealth, and this morning we're going to cover what we call the ConnectCenter. It's a relatively new product or suite of products, I guess I should say, that Relay has rolled out to the marketplace, and it's an opportunity for y'all to look at some expanded capabilities that are now available to y'all. We kind of call this a one-stop shop because we've taken claims, we've taken claims follow-up, remit information, even eligibility verification and historical eligibility transactions, and placed them all on one home screen or work screen that you can access all of that information from. So I'll be going through kind of a highlight of the tools that are available, and then jump into each one and do a brief review of those. It should take about probably 30 to 45 minutes. If you have any questions, feel free to type them into the webinar, and we'll address them as time appropriate. But what we're looking at right now, this is the home screen, and it's really divided into, I guess you'd say, 4 different ways to communicate information out to each of the submitters or to the users. And I'll just kind of go through the categories or through the sections. The first one, this is where we push out national regulatory type information. This was big when the ICD 9 to 10 switch took over, things like that. So any type of national information that's going to affect a broad group of folks, we can push information out in that panel there. The panel below that gives us the ability to push out any new enhancements that might be coming to this tool or other tools that are available to you. So it's an opportunity for you to be able to get additional information about options that you may not have. We can attach, sometimes you'll see information attached, sometimes you'll even see a brief video attached of that enhancement. So that's really an opportunity for you to see additional modules that might be now coming out. And later on in the presentation, I'll talk about our latest module that's going to be rolling out sometime probably in June. The next category that we look at this alert and notification category, this is going to allow you to go in and track information about your specific payers. So you can go in and search based off the payer. You can search off the title. You can even search based off of a date range. So if you want to look for everything for, let's say, Cigna, over the last week, have they had any maintenance issues, anything like that, you'll be able to pull that up that way. So we push that information out to you, give you the ability to search on it. Before I jump into this grid here with the pie chart, we talk about the layout of the site and how you can access the different tools, and then we'll jump right into the follow-up and actual claims. But across the top, you're going to see navigation that really allows you to navigate to a claim 3 different ways the way the tool's laid out. We'll go through the pie chart, which I think is probably the most user-friendly, at least for me it is. But you can go through a work list, pull up all of your claims that way. Verification, when we get into that, that'll be eligibility. We'll talk about that later. If you want to look for a specific claim or create a claim, we would go into that tab, and I'll show you another way to get there as well. Your remit information would be here, allows you to sort and find remits, and then attaches that remit to the claim, so you've got a historical reference with those attached. Reports are available. What we found with the users that are using the tool, that doesn't seem like they use the actual reports near as much, because we're now taking data and pushing it out to you in more of a color-coded graphic type approach to show you the claims that really need addressed. So we'll talk about that here a second. Payer tools, I'll talk about how you can enroll and set up specific payers, especially that enables us to be able to track the claim. It also enables us to be able to provide the eligibility verification back to you. Analytics, we'll talk about that also. What we're doing is we're historically taking your claim data in and comparing that against your different users within the tool. So if you see for some reason our claims are taking longer to get paid, or maybe taking longer to get to the payer, it gives you the ability to drill down and discover where those issues or problems might be. Before we jump into any of those, let's go to the pie chart. The pie chart, what it's doing, it's taking your claims that have been presented into the system, and it's segmenting them into these different categories. So here, for the demo purposes, we can see there's been 20 claims that are in the system today, and they've been sorted into these different categories. First off, well, our 20 and our numbers over here don't match, so that's a demo issue we need to address. But here, first off, you'll see green. We use the stoplight approach, makes it very easy, I think, for folks to, at an eye's glance, to be able to see kind of where they need to spend their time on the follow-up. So what you shouldn't have to do in the future with this tool is run a report and maybe sort it by largest dollar and try to follow those claims that way, or oldest claim. What you'll be able to do is here you'll be able to segment it, because what we've done is we divided claims in these categories. The ones that are green, that means that the claim has passed the edits, so we do have edits. We're not just taking the raw claim and sending it straight to the clearinghouse. We're verifying that that claim is going to be accepted at the clearinghouse. If it's not, it's going to be in this rejected category, and you'll have the ability, and I'll show you that here in a second, to actually open those individual claims, make the correction, revalidate it, so rerun it against those edits. Once it passes, then you can submit it right back to the clearinghouse. So those claims in red, those would be ones that haven't made it to the payer yet, haven't even made it to the clearinghouse yet, because there was something within the claim that you presented to us that needed to be addressed. And it'll actually pinpoint and show you what needs to be corrected, instead of just giving you a claim title. A denied claim, that would be a claim that made it through our edits, went to the clearinghouse, got to the payer, and for some reason was denied. A warning, a claim that's in the warning category. This is something that's probably going to be new to you, because what we're doing is we're going out and we're looking for, and actively looking for, claim status. And then historically, we're looking at claims that came from that same payer, and over time, we build out historical data that'll tell us we know a claim, and I'll just pick a payer, let's say Anthem. A claim going to Anthem we know should be paid, or maybe we should get a status update within 3 days, and we should get a payment within, let's say 30 days. When that claim falls outside those parameters, it's going to move it over to this warning. Doesn't mean the claim's been denied, doesn't mean that, it hasn't been rejected because it made it to the payer. It's just meaning that the payer's taking longer than normal for us to get information back. So that's one that you'll want to follow up on. So instead of going into all, in this example, all of these claims, you'll be able to drill into only the claims that need to be addressed. So let me open up the rejected claims and we can kind of walk through. So here there were, I believe, 10 in that category. It's going to list the claim, the patient. We can drill from here right into the claim. When we do that, it's going to tell us, there's an error here actually has to do with, looks like the state or county code. When we click on that, it takes us directly to the position or the location within the claim that needs to be fixed. From here, we're in a demo site, so I don't have to go into, the actual protocol. But here, what you can do, you can actually type in, the state prefix. Then you could go down, and when you hit the validate button, what it's going to do, it's going to take that correction that you just made, and it's going to rerun that entire claim against the edit engine that caught, this state abbreviation was missing the first time. Now it's going to rerun the whole claim and validate it, and if it comes back clean, or if it comes back, let's say, non-rejected, you can hit the submit button, and that releases it to go to the clearinghouse. So you have the ability to correct it right here within the tool. So if our clients want to go back and correct it on the claim and resubmit the claim to us, you can do that. But, what we found to be one of the, I would say, easier ways to correct a claim is you can do it right here within the tool. You can validate it. It gives you assurance that by fixing this, you didn't maybe affect something else, because if another rule or edit appended, then you would get another error that would tell you that that needs to be fixed as well. So you can get real-time validation that now this claim is good to go to the clearinghouse. Also has all the claim details, the service line information, the summary data. We'll talk about more of that when we get into the remit. But one thing I will talk about is with this claim tracker, and I talked about how historically we're looking at the age of the claim and information that we should be getting back at certain points. We're looking at these different, let's say, steps within the process. Here, this was the claim that was rejected because it had an issue within our tool. So it never made it to RelayHealth, the clearinghouse. So it didn't make it to the payer, didn't make it through any of those processes. But what we're doing is we're looking at each one of these, let's say, hurdles, and based off of historical information, if it's lapsed or it's past what historically, based off of that payer, we feel that we should be getting a response back, it'll drop that claim into that warning bucket. So that's kind of a visual element of how we're doing the warning piece. Also within the claim, you can go in and search an individual claim if you need to. You can actually even create a claim if you didn't submit a claim, or you need to do a UB. Maybe all the claims you submitted were 1500s, but you need to submit an institutional claim. You can do that right from within the tool. You can send us UBs and 1500s. We can process them both within the single tool. So you don't have to have a separate tool to do institutional claims if you guys do those. But our tool will handle both. We're also, and you know this because you're using this today, but we're also the clearinghouse. So when the claim comes to us, it goes through our edit engine and then goes to RelayHealth, the clearinghouse, and then onto the payer. So it's all staying within our suite of services. Moving over to the remit. The remits are coming in. We're matching them up to the claim. You also have the ability through the search engine, if you want to find a specific remit, you have the ability to go in and search. For demo purposes, I just want to bring one up to be able to show you what a remit looks like and how you would actually access it. But here it's listing all the remits that we have in the actual demo site. We'll open one up. And from here you can see several things. One, not for sure how you actually post your payments, but you do have the ability, if you're waiting until a payment maybe hits the bank, you can requeue this at the time that that payment has now made it to your bank, so you can post it, so you can requeue it at a later date. The data viewer provides you, and you'll see the data viewer tab on many screens. That's giving you the raw data that here we received back from the payer. We also can show you that on the claim. So if you've got a question, or we'll say the payer has a question, you'll be able to see what came from the claim you submitted, what we actually submitted via the clearinghouse over to the payer. So you'll be able to get to the raw data if you need to do that. You'll see within the claim, or within the remit, if there were any adjustments made, that'll be listed here, and then the claim detail will actually be here. So you'll be able to drill into the actual payment information, service date, the actual procedure, so the line items and the payments that were made appropriate for that. You can also view your EOB from here, and you can print it out from here if you need to do that. So it gives you the ability to get that EOB information, from this screen as well. It'll also give you the ability to go back to the claim. So this is kind of where we were when we were looking at that claim. Now you can see this one. We're going through the remit, going backwards from the remit to the claim. You can see, where this one made it to the process. And it's, for example purposes, it's showing it was denied. We know this one was paid because we looked at the claim, but for demo purposes, we're trying to show you all the options. So this one would show, it made it through the edits, it made it through the clearinghouse, it was received at the payer, but then for some reason there was an issue once it got to the payer. And that all would be pushed back to that pie chart on the front, and that's how you could access that as well. Moving over to reports, like I said, there's an array of reports. I think we only have a couple loaded into the demo site. You can go in if you need to search on all your rejected claims. I mean, you can do reporting probably like you're working off of today. We found most of our clients that have converted over to the ConnectCenter very seldom go to the reports tab, because they're going to get 6 months worth of data up on the front end pie chart. They'll be able to use that at a glance, or go into the work list and pull their claims tracking and updating from that as far as their work list. But if you do want to go in and run a report, you have the ability to do that. I think we'll just open this, but I believe we've got a couple reports here. We have one just for example. But you go in from date range, you can run it. The reports on the claims or remits, it's going to bring you back a human readable text type report that you're probably accustomed to today. Payer tools, just kind of moving across the top panel here. This is how you set up the payers. This becomes important, especially for us to get those updates on the claims. That's what we're driving all of that. Your follow-up information on, and pushing that information to the pie chart, especially showing you the claims that are maybe falling out of that update range. Here you'll go in and actually enroll the payers. You'll have the ability to go in and search the payers to see if you've got one specific set up. There is some ability to select which edits you want to turn on for that specific payer. So there may be certain edits that you want us to run the claim against for payer A, but maybe not payer B. So you have some ability to do that. And then the credential management piece, really what we're doing there is we're storing information that it's really login information for that payer's website. And that's going to allow us, when we're going out and looking for a claim status or a claim update, we're going to go to the website to pull that back. So we're not waiting on the payer to provide us something. We're actively going to their websites to get information from them as far as where that claim's at in the process. We do the same thing with eligibility. When an eligibility request, it's the verification tab over here, but when an eligibility request is submitted from y'all, what we do at that point is we go to that payer's websites and we pull back information off their websites. We go to the websites because we found that The data seems to be much more accurate, much more up to date, and a lot of times we bring back information from the websites that aren't on the traditional 270, 271 responses that that payers make available more in a report format. A lot of times we can get information like deductible met year to date, for example, and that type of thing. So, and we'll cover that when we get into the verification tab. Let me stop here for a second and see if there are any questions before I continue moving through the toolbar at the top. Has anyone submitted any questions? Okay, I don't see any, but if anything, anybody has any concerns or issues or things we want to address deeper, please feel free to bring those up. Analytics, let me open that up. This usually takes a couple seconds because it is driving quite a bit of data even in the demo site. And hopefully I didn't talk too long and have it go to sleep on me. We have to open it up again. We'll give it a second. But what the analytics tool is doing, it's looking at your data and it's comparing it, here we go, it's comparing it against your group of, let's say, submitters, your users, can really be used in a assortment of different ways to drill down to data. So when we look at this all available information, it's set up, I guess you'd say, in the parent-child relationship. So we've got some of our customers can compare all of the physicians that use the tool. You can drill down at the physician level, which of your actual submitters are submitting claims, and we want to compare, one versus the other as far as the different thresholds or claims being, taking longer for one person to submit or another. You also have the ability to sort it by state. So if you've got multiple facilities across the country and you want to compare, how the Florida state doing versus the Georgia states, you can sort that way. You can also sort based on specialty data. So it's giving you different ways to view the dashboard, really to slice and dice the data. So let's just open that up. And it's looking at 4 different categories. So we're looking at submitting the claim, and this is comparing it month to month. So here we can see we're not doing as well as we were in February. We've gone, we're almost 17.5% longer, or which rolls out to roughly 3 days. It's taking us longer to get a claim submitted. When we're talking about submitted, that's a claim that's coming actually to us. And then the transmission of the claim, the payer processing. This is looking at how long it takes that payer to actually process the claim, and then this is looking how long it actually to get the payment back. We're also providing you the data. We're looking at your payers that you use all the time, and we'll bring back information to you that any payers that we suggest that you connect to electronically for those remits. It adds a lot of, actually speeds up the process. It also allows us to track. We can't track a paper permit through this remit, but we can track an electronic remit. So we're going to, really help target some opportunities for you as far as the ERA there as well. So let's just open up this first one. Submit claim. We see we've got an issue. Let's just open up the tool based off of the criteria that we submitted or that we selected in the beginning, and I didn't select any because we were talking, and that may have to go back and actually select some criteria that's going to tell us how we want to slice and dice it. But what it's going to do, it's going to take that data that says overall it's taking us 17 days longer to submit a claim. It's going to drill it down. Oh, come on, I'm talking and hitting buttons, and now it's I'm just going to reopen it back up, and we'll go straight through it this time instead of me talking so much. So what it's doing is taking that data that says, it's taking us 17% or 2 days or 3 days, I forget what the data is, longer this month than it did last month to submit a claim. Well, is that across the board, or is there, one location or one submitter that might be, causing that, or is it one claim? It might be one claim that's, taking weeks and weeks to get into the system, and that's what skewed the numbers. So from here, let's go in and let's filter on, here we go. We'll just filter on that criteria, and we'll do it on the standard data. Once we open it up, now it's going to take that. I think the numbers are going to stay the same because it's the demo purposes, but in the real world with real live data behind it, every time you change those criteria, these numbers are going to change because now we're not looking at the whole as much. We're drilling down maybe by state or by specialty or by one submitter or one location. From here, now we can drill in, and we'll start to get more specifics on who's our culprit, who might be causing those issues. And maybe it wasn't me. Maybe the site's not filling right now. Worked when we were testing. Maybe it's just because of the web that we've going. But what it'll allow you to do, it'll bring up that 17% change, but then from there you can drill in, and it'll show you the individuals or the locations or the physicians. If you picked a specific specialty, it'll show you the physicians, and it'll show you which one might be 30 days over, which is causing that 2-day skew. Or you can get down to the individual submitters. So maybe there's 7 or 8 people once we did the drill down that are actually submitting claims to the tool, and you'll see that of those, let's say 8 folks, 3 of them are 40% longer this month than they were last month to submit claims. It might be people on vacation and nobody backfilled for them. And there's ways to drill down into that data instead of just looking at it as a whole and say we've got to do something. We're 2 days longer on submitting all of our claims. Well, you might have buckets that are causing that issue. So this gives you the ability to really drill in and identify those specific areas of concern. I'm not for sure why that's not allowing me to drill in there, but that's our analytics portion of the tool. The last piece I want to jump into is eligibility. And when we first started, I talked about that screen down in the lower, I guess, right-hand panel that talked about new enhancements that are coming out. Well, here you'll see under the verification tab, you see eligibility, which we're going to jump into. You also see patient estimate and estimate history. Right now we're in beta, and we're ready to take it to the marketplace as far as being able to give you the ability, and this would be an optional tool that you could add to, let's say to your tool belt, that would be all within this kind of one-stop shop. You'd be able to do an estimate based off procedure. So if the patient's coming in for, let's say, a routine follow-up, we'll have your charge information, your charge master information for those procedures loaded in. We'll also have the payer plan codes in there. So as far as we know what the allowables are, what the adjustables are, we'll go out and check eligibility, so we'll know what the patient's copay and remaining deductibles are, apply those numbers against each other, and actually you'll be able, at point of service or even prior, if you're doing like a pre-registration, you can tell that patient, here's what you should expect for your out-of-pocket cost to be for this service. So I said we're rolling that out in June. So that's our patient estimate module that will be added. As far as eligibility, you can do a new eligibility request. Basically, fill in the patient's information. And one thing I talked about, or maybe I didn't, but I want to make sure and stress, when we bring back this information, we do it in a normalized view. So you have a couple ways to go out and search the data. You can pinpoint a specific coverage if that's what you want. If you want the standard 30 coverage, then that's basic health care plan coverage. But if you want to get into certain types of specific coverage areas, you can select those, and that's what we'll pinpoint when we bring it back. You also have the ability, once we bring that back, to look at it in different views. And let me actually open up an eligibility response so you can see that. So we'll go into the history tab. And here again, we can go in and search just like you could on the claims or remits for a specific patient. But I'm just going to open up the database to pull one up. And let's pull up this guy. Actually, let's pull up this one. And it's going to bring back the eligibility information that we found. Here we're looking for the standard 30 coverage. And again, that's based on what you selected when you did that initial eligibility check. But it's also going to give you different looks that you can sort the data in. And typically, folks are going to bring it back in a Medicare, looking for, format if that's what you want. We can bring back copay, we can bring back deductible. There's multiple view options that you have that will streamline the data that we actually present. So here you can see as you select these different type views, it's going to sort that data. All the data is being returned back from the payer, but if there's just specific information you want to get to, then like here, this deductible remaining, here it shows they have a $1,350 deductible, but they paid about $450 so far of it, $350 I guess so far of it. So it gives you the ability to drill down to just exactly what you're looking for instead of sort through the entire eligibility response. And we store that eligibility data is stored within the system for up to 6 months. So if your patient comes in and you can go out and check eligibility again, or you can, if they were here within the last 30 days or even the last 6 months, you can go in and check that data as well. For claim data, claim and remit data, we keep it within the tool for the first 4 years, and then after that, for the next 3 years, we archive it offline. So you have 7 years access to claim and remit data as well. So 6 months on the eligibility information and up to 7 years on the claim data. Within the toolbar, let's move forward. Within the toolbar, the data that we're populating here, you can go back to and run this chart based off of, I think it goes back 6 months, is the data that we're populating here. And we're using our analytics tool to actually come up with this data. Any questions? As far as installation, it's a pretty easy install. Within a matter of weeks, we should have this up and running. And then once we've got it up for our customer, as far as setting the individual physician offices up, it's very quick. So it's from a brand new customer that we sell that doesn't offer this, we can bring that up in about 30 days. For a physician office that's signing on with one of their business partners, it's a matter of days, and they can have access to the tool. And that pretty much covers the ConnectCenter and the capabilities of the tool. So what we've done is we've taken what used to be just a direct connection of the claim form and sent it straight to our clearinghouse. We're now bringing it into this tool, running it against some edits so we can catch any minor errors that might be on the claim before it even goes to the clearinghouse. We're also looking at claims that have gone to the payer and notifying you if there's some issue that, and doing the same thing at the clearinghouse. So if for some reason a claim is sitting at the clearinghouse and over historical data, we realized that a claim should only be at the clearinghouse for, let's say, 24 hours, and it's maybe now 48 hours or 26 hours, it's going to drop in that warning bucket. So it's not just looking at the payer, it's also looking at the clearinghouse. It gives you a much, I think, more streamlined way to address potentially problem claims as well as problem claims themselves. And with that, I think we've covered everything that we were going to go over today.